Hi, this is Dr. Dan Margolin of New Jersey Foot and Ankle Center doing the next in our series of most commonly asked foot problems. You know, one of the questions I get asked a lot is regarding orthotics. What is an orthotic? How does it differ from an arch support? So let me show you. This is a relatively fallen arch. It's a flat foot. And for a treatment, many times we use what's called an orthotic. Now this is just one example of an orthotic. This is actually a relatively soft one used for runners, used for sneakers, usually used in patients over the age of 23. Before the age of 23 we can use a little bit of a harder material, but after the age of 23 there's already some arthritis that's set in and we tend to go with a little bit more of a flexible orthotic. But what is the main question that I get regarding orthotics is that versus arch supports. So a lot of foot problems are related to an arch that comes down too far. But it's not just that the arch drops too far. Usually when you're really seeing people with severe foot pain, plantar fasciitis, Achilles tendonitis, it's not just that the arch is dropped, it's also that there's now a change in the angle of the front to the back of the foot called a forefoot varus. In other words, the front of the foot has actually tilted upward as that arch is dropped. What that does is when the person hits the weight-bearing surface, they tend to go over more. With an orthotic, what we do is measure the angle of the front of the foot to the back of the foot and fill that in. Okay? That filling in of that angle eliminates a lot of that twisting or the tearing or the torsion of the foot as it comes over. It actually supports it. So it doesn't just support the arch like an arch support would. It actually addresses the angle of the back to the front of the foot that is different for each person. It is customized. It is really the difference between wearing custom eyeglasses or eyeglasses off the shelf. This is Dr. D. Margolin bringing you the next in a series of most commonly asked foot questions. Today is orthotics. Thank you for joining us.